This month, we'll be answering your COVID-19 vaccine questions. We took Ann Shepard-Royve's question to Dr. Steve Fagans. He's with Mercy Health, and he's the medical director of Hamilton County Public Health. Ann wrote, quote, "A friend and I registered with Hamilton County Public Health a couple of weeks ago on the same day. We're both 74 years old. Her birthday was in December and mine was in November. She was called and has already had her first shot. Why is there a lottery? I have called many, including my healthcare providers, as well as retail pharmacies, CVS, Walgreens, and Kroger. All have recorded messages that all slots are filled." And then she said this.
"I wish there were a better and more consistent system to get shots into 1B eligible people's arms."
And we absolutely agree and really ask for patience. And so how it works from Hamilton County Public Health is when you call in or you put your name, individuals who, many of the we have 14 contact tracers who are now making those calls, and they work off the list. And so when the name is on the list, they work down that list, independent of birthday or anything like that. It is very possible that the contact tracer may have called, and it may be blocked or it may not be picked up. Remember that they're calling from a number that says Hamilton County Public Health, not some specific number. And so if you see that, and they're calling on that from that number, specifically the same number of contact tracers used, so that you know that a real contact tracer is calling you either to talk about contact tracing or, better news, to talk about scheduling the vaccine.
How long have contact tracers actually been working the vaccine phones?
So when we opened up the lines just before we had vaccine, we had asked for volunteers to work that, and lots of people raised their hand. We have 14 currently who are making those calls. When we first started, we had 700 doses. It took 14 contact tracers 4 days to schedule 700 of above 80 for their vaccine, in part because of the length of the call. Individuals who have been sitting around not talking to folks for a year or so really wanted to talk, and you want to talk to them. And so they're wonderful calls, but each one of them takes time, and that's why it just takes a while to get that down that list. Be patient. We will get there.
If you get a call and the contact tracer leaves a message, if you don't respond to that message, do you lose your place in line?
No, they'll call you back.
Oh, that is certainly good to know. Dr. Fagans says they should leave a message if you have voicemail set up, and he recommends you act on the message and follow its instructions. He made a point of saying the lottery system, or the system, is not lottery bound. We are answering your COVID vaccine questions here in the 7 p.m. newscast. If you have one, you can email newsdesk@wcpo.com or just message me on Facebook. We'll try to get you an answer.